So welcome to the Surgeons in 3D Printing podcast. And I'm back again after a week with a very special guest. I have with me a passionate trauma surgeon, also called the Google Glass Explorer, Dr. Rafael Grossmann. Welcome, sir.
My pleasure. My pleasure to be here.
Yes. So may I request you to please tell the listeners about yourself, the hospital you work for, and of course, your mission with technology for healthcare.
Yeah, well, I am a full-time surgeon, a trauma surgeon. About a third of what I do is elective surgery, but most of what I do is trauma and emergency surgery and surgical critical care. I'm from Venezuela originally, and I'm an immigrant to the United States. I've been here for several years, though. I did my training in Michigan. And I've been in the Northeast U.S. in Maine for almost 17 years, and wow. That's sort of what I do in the Northern Light system, and along with being a full-time surgeon for the last almost 15 years, I've been really passionate about pushing the message of the convergence of technology and healthcare, trying to enhance and augment how we do and how we teach healthcare and education. I think that with the exponential technologies that we have these days, it is really completely unacceptable that healthcare and education are in the states that they are. And also that so many people globally, around the world don't have access to the healthcare that they should have access to. So that's kind of my mission.
Wow. And I agree with that there is a convergence using technology and healthcare together. So that will really make it available to a lot of people who are really for whom it is really not accessible. So with that, I'd like to ask you, what aspect of trauma surgery do you like? Because I come from a trauma center, level 1 trauma center, All India Institute of Medical Sciences, New Delhi. And so I very well know that trauma surgeons have a very specific way of interaction, which is very quick as compared to all the other specialties. And I find it very efficient. So I would like to know, which is the aspect of trauma surgery that you love?
Well, I think that the most rewarding thing is to be able to make a difference, right away. You have a patient who's critically ill, someone who's potentially going to die, exactly. And then you can, by doing teamwork and scientifically proven, methods, you can quickly change the outcome, and that's probably what I like the most. That the potential, to make a real difference real quick.
Yeah, exactly. And so, I'm just wondering, like, the conventional surgeons would never kind of say that, telehealth is something very unconventional for people, but you've been doing it even prior to COVID, because after the pandemic, of course, telehealth did come into practice, but you've been doing it before that. So what did you see? What was the potential and what was the need for doing it then for you?
Well, the way I see telehealth or telemedicine is really it should really be telemedicine. It's just medicine. It's just exactly. The way that we connect and we communicate amongst ourselves and with patients and relatives. Now we have different tools, and we've had them for decades, right? Exactly. We've been trying to push telemedicine for many decades, and there have been a lot of hurdles and obstacles, and very difficult to do. And it took the pandemic just a few days exactly. to really make us desperate enough to engage with these old tools already. So sometimes that happens. It takes a cataclysmic event to really make us think differently. I've been really preaching about telemedicine for almost 15 years or more. When the iPhone 4 came out with FaceTime, the video app, then I thought, wow, this would be an incredible tool to replace the hundreds of thousands of dollars machines that we had for telemedicine. And we did actually a pilot project with an iPod Touch, and that was the topic of my first TED Talk. The first TED Talk I did, I've done a few. I think think about 5 TED Talks, but the first one was about using an iPod Touch in a system of 7 hospitals doing teleconsultations for trauma on cellular. Yeah,
so
on cellular.
Like, which year did you do that? Like, it should be like
this is 2011 when we did this. Oh my God!
So we had to make the pandemic to happen so that it comes worldwide.
Yeah. Oh, wow. So then after that, I a few years after that, about 2013, I saw the potential of Google Glass. I was attending a course at Exponential Medicine, and I saw the inventor of Google Glass showing us what Google Glass could do, and I had another, aha moment, saying, "Wow, this tool could really change how we communicate and connect." So that same year, a couple months later, I did the first operation with Google Glass, and people just went crazy about that. It was very disruptive to do that, and it was just a simple thing to connect me better with my students.
In my country, also, you're known as the Google Glass surgeon, so people know you like that. Yeah. Wow, incredible. So after Google Glass, where did you look at the next technology? What was the next technology which kind of intrigued you?
Yeah, well, certainly over the last few years, I've been doing quite a bit with artificial intelligence and trying to learn as much about it. I've done several certificate courses at MIT, but along with that, probably virtual reality, augmented reality, mixed reality, what we call extended realities, have been really the focus. Trying to engage with different hardware or software companies and groups, advising Magic Leap, for example, with healthcare and many other software content provider really to bring that tool as another bridge to communicate and connect better. I think that certainly virtual reality now has a clear role in many areas, but especially in healthcare and in the healthcare education. We have seen that already for a few years now. We've had many papers and validation of VR therapy, not just VR for learning and diagnosing, but for therapy of patients. And in the field of AR and mixed reality, we are seeing more and more uses in learning, in education, and also in treatment, in surgery especially. We've had, even yesterday and today, there are events. There's an event worldwide that Microsoft is providing, where surgeons from different parts of the world are engaging in tele helping or teleconsultation, but multiple experts in different parts of the world using HoloLens during a live operation. So that is a better way to communicate than what you and I are doing, for example, if we are operating on a patient. So it's really fantastic.
Yeah, it gives
really
so
fantastic.
Much. It gives you really such a lot of information, and it's just amazing to see that.
Yeah,
exactly. So I also read something that there could be an empathy deficit if this kind of communication goes on. It is a machine which is working, but while I heard you saying that we can bridge that empathy, we can bridge that empathy deficit using technology, and so these two were like completely opposing things. So what is your take on bridging the gap of that empathy deficit which is present in healthcare at the moment between the surgeons and the patients, or whatsoever?
Yeah. Well, I always say, that technology is just a tool, right? A tool to help us. And technology is as good as we make it, or as bad as we make it. And it is, I think, very, very strongly think that technology can actually make the interaction better, and especially in healthcare, can make the patient-doctor interaction also more humane and more empathetic. We have lost, unfortunately, in the last couple of decades, with the advent of digital health used in a bad way, in a poor way, in the wrong way. We have really seen a loss of compassion, loss of empathy in medicine, because we're focused on the machine. We're not focused on the patient. Exactly. And I think that now we have the technologies that, if we use them smartly, directly. We can connect with the patient directly, and we can have maybe the head-mounted device like Google Glass or like Vuzix Blade or like HoloLens or Magic Leap provide us with all the digital medical information from the electronic record in front of us, and we basically have a still even better contact with the patient, and so we grow on that empathy that is so important for the patient-doctor relationship. So I think that is about the use we give it, and I think that is a phenomenal tool to do that, but we need to push to rescue that very hard.
Yeah. And I totally understand that part, that we need to use technology to our benefit rather than technology using us, which is happening the other way around otherwise.
Exactly.
So, Dr. Rafael, you know what happened? I read about you that you're from Venezuela, and I could connect that you have your roots in a developing nation. And, you can very well understand the problems that a developing nation faces in terms of the economics that it has. So I could really want to ask you about that. What do you think? How did you overcome those challenges of, starting with technology, because these are all expensive things happening around. Like if I want to start with VR, it's going to be an expensive stuff. So how did you manage that expense? How did you go ahead with that? And how could you spread it? Because it's not about just me doing it. It's like about, spreading it. So how did you do that?
Well, I think that, all technologies start expensive and big and slow and not maybe even very nice looking, and then with time technologies certainly evolve, right?
Yes.
And they evolve fast and somewhat exponentially, we could say. So they become smaller, they become less expensive, they basically increase in power, and I think that in a way the technology can help us in a way spread the message and make the communication more widely available. So eventually that will allow in this case healthcare, for example, to be more accessible. So initially, obviously, if you are in a place that has less development, or a place with less socioeconomic development, low income, certainly it's a more difficult job to do at the beginning. But with time, I think that the thing almost inverts because it allows us to connect and communicate better with those areas that don't have the resources or the means. We saw it with the smartphones, right? Where initially no one had phones, then people had phones, then people had cellular phones, and then people had smartphones. So now it's growing and growing, and more you see people in very, very odd places where they might have a headset. When Oculus Rift started just less than 5 years ago, right? It was connected to a very expensive computer, and now the Oculus Quest is $300, and it's a more powerful than the first machine almost. So I think that it's just a matter of time.
Yeah, exactly. So we need to just stick around with technology for some amount of time, so that by the time it evolves, you are like evolving with the technology.
Correct.
Yeah. So what do you think is the first step if one wants to move towards immersive technologies?
Well, it really, I think that the first step is to get to know about it. I think that staying curious and staying connected and networking, and that's one of the things I try to do. I'm a full-time surgeon, but I see also that I have a responsibility, as a practicing surgeon who's on the trenches and living the problems of healthcare. I think that it's a responsibility for me to also be a communicator, so a preacher of the message, because if you want to start with that, you need to hear it from someone, and there are a lot of messages out there, marketing messages, companies and people who who are creating stuff. But I think that when you are, let's say, in healthcare, and you hear someone who's in healthcare talking about this, then you almost make it's a little bit more of a trusted source, I guess, in a way, because you know that person really is actually living the same problems that you address. So I think that's important.
Yeah, and I think it makes you feel that that person is communicating the right problem, because they know the problem. They are in that system to know the problem. So yeah, that definitely connects better.
Exactly. That's very important, I think.
So do you hold any, I would like to ask you, what are the kind of technologies that you feel can be used in an OR setup, in an acute OR, because people usually say that in an acute setting, you can't use many technologies. So in your experience, what are the technologies that we can use in a trauma center, in an emergency room, for example?
Well, I think that anything that allows us to connect and communicate better, anything that allows us to connect with the medical record better, anything that allows us to connect with the patient better and get data from the patient, it's fair game in chronic and an acute disease. If you can think of a trauma patient who comes in and the patient has already all their medical physiology, parameters recorded on an Apple Watch or on an Oura Ring or on a chip under the skin. You can imagine the potential of getting all that information immediately. In the acute trauma setting, for example, right? Imagine a patient who comes in and suddenly you are able to access, you do a tomography, right? You do a CAT scan, images of the abdomen, for example, and you're trying to figure out if he has any injury intra-abdominally. And then you can get those images, and then now we have to wait a few minutes and go to the computer and look at the images. Imagine if you had a Magic Leap device or a HoloLens, and the images were immediately loaded as fast as in the computer, as fast in the HoloLens, and you could look at those images in 3D renderings, and you could go in any angle, not in three axes, is like in CAT scans, sagittal, coronal, axial, but you can go in any angle and see the images right there in the trauma bay, and you could then make a decision rapidly and rush the patient to the OR or to the ICU or whatever. Imagine a patient with a massive facial trauma, and you could have the way to very quickly get 3D images of those bones, and then I see that it's we're talking about surgeons in 3D printing. You could quickly, immediately 3D print parts, for replacing the missing bony fragments, for example. There's a company that I'm very fond of who's starting. They're called TechFit, and they're based in the U.S. and in Colombia, in the country of Colombia, and they are also they have the mission of democratizing 3D printing. So imagine that you could get a 3D printed part, in just seconds or minutes. All those things are possible. So I think that in acute care as well as in chronic care, technology has a tremendous role that we are barely tapping. So it's really exciting.
Right. So we basically need to change our mindset as to use technology, because otherwise conventionally people feel that, you just can't use it for an acute setup. Like usually that is the feeling that you have. So I think that mindset needs to really change on this. Absolutely. Right. So I would like to ask you, what is the kind of strategic relationship that you hold with the companies in order to kind of get the technologies to your hospital? Because you would have worked with the companies to get the technology to the hospital, isn't it?
Yeah, Ruchi. Yeah. So the things that when I did that first operation with Google Glass, right? I had the technology myself. I was given the technology on the Google Glass program, and I, after getting permission from the patient and the family and the team, we did the operation in a secure manner, protecting the patient's information, and that was all successful. But then the hospital actually, it was very negative about it.
Exactly. That's the reason I'm asking all of this. Yeah, it happens.
Well, I got reprimanded. I almost got fired Wow, I was, we wrote a post about that. My good friend John Nosta wrote a post in Forbes, and it went viral after just a couple of hours. But the hospital instead almost fired me. So the system wasn't ready for that. And unfortunately, almost all of the stuff that I have been preaching about and going to other countries even or other states to help set up systems and programs and none of those tools I use in my own hospital. So it is important that you are in a place that has the vision of innovation, of real innovation, to really creatively disrupt healthcare. And that is the only way that you can bring those tools. So the connections I make, the more I grow my profile and I connect with amazing people and communicators such as yourself, then the message gets out, and then I get more connected. And then just today I had a couple of meetings with a couple of companies, and you can be a full-time trauma surgeon and you still do these things because you can be on the phone, and the person can be in India or could be in China or could be in Argentina, and you have a so it's easy to connect using technology.
Exactly.
So I think that. And then, I get sent the devices and I try some of these devices. In the case of Google Glass, for example, it took me almost 3 years to convince my hospital to use a technology that was already commercially available, that it was already proven safe, that had been used by 20 some hospitals already in the world, and that was a Google Glass to be used as a medical scribe. There's a company called Augmetics, and this is after when I did the operation with Google Glass, no one had used Google Glass ever almost in the hospital, I think, and certainly not in the OR. That was the first time. But then almost 2 years later, I got got connected with this company, and they wanted to do this trial, and my hospital refused. No one had done it before. It took 3 years of pushing and pushing and pushing, of me pushing, tried to get them, and they finally agreed. And now they love the technology. It's basically using Google Glass to bring a human located somewhere else, in India or anywhere else, and you have a scribe with you when you go see a patient. So instead of focusing on documenting and getting all the details right, all you do is you have your conversation with the patient, and the scribe is directly connected, and they are populating the medical record. So at the end, you go to the medical record, you look and you sign, and you go to the next patient. 3 years it took me to convince them. At the time when they embraced this technology, they were already the 26th hospital in the U.S. using it, when they could have been the first hospital. So if they imagine the kind of PR that they could have gotten from being the first, but they refused. So it's hard. It is hard to change minds. But
I think your persistence has been really great because I heard your name at that point in time. I still remember that, it was like in my country, it was viral, that there's this Google Glass surgeon, he's operated a patient in the Google Glass. So it was, So I still remember that so well. Exactly.
I'm glad.
I'm so happy to talk to you, actually. It's really nice to connect
Ruchi.
with people.
Likewise.
And especially somewhere it is a commonality, because I have been through the OR, and I feel that thinking about telehealth makes people, it was not making people comfortable, but this pandemic actually got everything in place. And I think it had to happen for the reason. And so a lot of things have definitely come virtual that way. So I'd like to ask you, what was different for you in the pandemic with respect to the work that you're doing?
Well, the work itself is the same, because mostly I do emergencies, right? So that doesn't change. We saw a period of maybe a week or two when we had very much nothing, and then, it came back to normal and even more. Certainly the pandemic, the way you approach a patient has changed, with the now a stress on protection, of the patient and protecting the provider, PPEs and masks and respirators and whatnot. All of this is really a burden, and it's really, really difficult to adopt all this so quickly and persistently, for months and months and months. But obviously, it's important. So that has really been the main issue. You have to be very careful protecting the patients and protecting yourself more than ever. And if you enter the ER, you have an N95 mask, and even if the patient is not, personally, I assume that everyone is infected. You can't know, You cannot know who's infected or not. So I just assume that everyone is infected and take maximum precautions at all times. And then imagine, if you operate on someone whom you know that they're positive, right? Because even if they're negative, there's a false negativity rate, right? Yes. So you have to really be it adds a level of stress. And if you think about, the other providers that are, pillars of healthcare, right? The nurses, how poor nurses, the nurses have it much worse than we do, because we might see a patient, for a few minutes, a few hours. The nurses are there,
constantly.
12-hour shift and constantly in and out and in the ICU. And then, so the nurses are really the real heroes of this pandemic. And also, we got to talk about, the issues that the pandemic has brought in mental health, right? Not just from the provider side, but in the patient side, how people is trapped at home. And with a reason, it's important that people, I think that it's very important that we promote, social distancing, and promote the use of PPEs. And, this is a question of survival. But that obviously has brought a lot of mental issues, which are real. And sometimes when you see patients who have these mental issues, or when patients see, providers who have mental issues, then, the connection, the communication then suffers. And that's a problem.
Yeah, definitely. That has gone to be like that. So it was really nice talking to you. Now I'd like to ask you if there's any message that you'd like to give, because you are a great communicator. So any message that you'd like to give the audience? Because listening to you, people will be really intrigued to catch up with technology for sure.
Yeah, no, thank you, Ruchi, for the opportunity, and it's really I'd love to stay connected and to really continue to communicate and connect with your audience. I'm very active in Twitter and LinkedIn for this type of reason. And I also have my website, which is a blog. It's an educational blog that is really interesting and has all the information that I really feel that it needs to be shared. But the message would be a message of thinking that technology is not our enemy. Technology is part of being human, just like we carved the first stones back in the ages, to bring in rovers to Mars. It's the same concept of technology, and technology is as good as we make it or as bad as we make it. And that is really important that we use technology in a smart way to connect and communicate better in healthcare and in education, and that it is really, really paramount that we use technology to rescue, the empathy and the compassion that must be present in the healthcare interaction.
Definitely. Thank you so much. That was such a great message. Thank you very much.
Thank you, Ruchi. My pleasure.